Are you waking up with a sad banana? You have low energy, sluggish, just not feeling yourself? This is probably an indication you have low testosterone. Today, we're going to be taking another look at testosterone and kind of weighing out the pros and the cons to TRT, testosterone replacement therapy. And we're going to explore if it's the right choice for you. Let's get into it. And don't forget to stay to the end because I'm going to be sharing my opinions on the best way to know if you have enough testosterone naturally and what to look for with your lab testing. What's going on? My name's Andy J. I am here to help millennial men feel our best. Welcome to the Brotherhood. Today we're going to be talking about a very important topic, TRT. That's testosterone replacement therapy, taking testosterone to help increase our levels so we can feel better as men. So the way I'm going to structure this talk is first I'm going to be talking about the benefits of why you would maybe want to consider doing this. The second piece is going to be about sort of the pros, and then we're going to be talking about the cons to try to help you weigh out your decision. Now, me personally, I've experimented with testosterone replacement therapy. I've used it. I haven't used it. I've tried to boost my testosterone through natural ways, through medical ways. So I try to find a lot of different ways to do this. I believe that we should have slightly higher levels than what doctors would believe to maximize muscle recovery and muscle building, but also just feeling better. I noticed my sleep got so much better when I started to work on optimizing my testosterone levels. And then just generally waking up and feeling like I did when I was like a lot younger, noticing that there was a little bit more activation in the morning, if you know what I mean. But before getting into the content, don't forget to like, subscribe, hit that bell icon so you're notified for more tips on how we can optimize our hormones and other things like exercise and so many other topics related to this. So, join our community because we're trying to grow this new channel. I made a lot of other videos on more natural ways to increase testosterone. And so definitely check those out. Maybe I'll put a link at the end of the video for those particular videos. But today we're going to be talking about a more direct approach where you're basically just be supplementing with exogenous testosterone, like taking testosterone from an exogenous source to increase your testosterone levels overall. The issue is with a lot of these natural supplements is they do improve your testosterone levels, but they're not that significant. So if you have really low T levels when you do your testing, you may need to use this supplement method if you cannot take enough time to do an assessment of what's happening in your environment that's suppressing your testosterone levels. The other thing is, as men, as we age beyond, your testosterone levels are going to drop naturally and your estrogen levels are going to increase. So you really want to fight to keep your testosterone levels up as long as possible, because it's kind of a weird thing. As men age, they almost become more and more feminized because you're producing more and more estrogen. And I don't know about you, but I don't want to be transitioning into a woman as I'm aging. I want to stay feeling masculine and feeling strong as a man. So I want to make sure I'm keeping my testosterone levels up. So what are some benefits of using TRT? Some of the things I talked about at the beginning of this video: you're going to notice a rise in energy levels, making daily activities less exhaustive and improving overall stamina. It's also been shown to be a big mood enhancer. I notice me personally, I can take on stress and I feel a little bit more balanced when stressors are coming into my life. And so it's a really good way to kind of balance mood. Also, being overly emotional, it tends to be a symptom of low testosterone because estrogen is taking over. And so it's not for that we're going to be robots, but to be a little bit more well balanced and with your emotional control so you can handle the situation and not let your emotions spiral out of control where then it makes your life more difficult. The other one that I really like is it increases libido. For me, I really like to have feeling like I have a higher libido than a lot of other men. It just feels good to me to have higher sex drive. So that's a big benefit that you'll notice. If you find that you are disinterested in sex, this is a strong indication that you're probably low in testosterone. And then there's one of the most obvious ones that most people think about when they think about testosterone is like helping in the gym, helping build muscle. It helps with like allowing you to burn more body fat and build more muscle. So overall, I think we can all agree that it's from a physique standpoint, testosterone is going to help us feel a lot better and just build self-esteem and just all that good stuff. So like I said before, you can use like more natural ways to supplement, and I don't want to take any time to explain that right now because I've dedicated entire other videos to habits and lifestyle changes you can make to increase testosterone. But sometimes that's not enough. You'll notice like you've made those changes and you're still feeling not optimal from a kind of a male energy standpoint, meaning like you're feeling low in testosterone. So you may need to consider TRT. Also, there are some men that have genetic predispositions to just naturally produce low testosterone. And if you're one of those guys, no matter what you do, you're going to need to supplement with testosterone. But the only way you can know is going to your doctor, talking to him or her about this condition, or having them assess for you, and then deciding if TRT is a good option for you. So those are sort of the benefits. Now I want to talk about more of just the general pros to supplementing with TRT. One thing is, like I said before, the natural routes do work, but they can take a really long time. So if you want to just feel better very quickly, supplementing with testosterone replacement therapy is a great way to accelerate that process. And with that, you can quickly start to turn a corner as far as excessive weight gain, mood issues, all that can start to really move out of your way, and you can really start to take control of your life a lot more by supplementing with testosterone, because the results happen very quickly when you're able to just supplement. What's interesting is like sometimes you've actually had low testosterone for so long, so your standard of what life should feel like is kind of at a low level, and you don't really actually even know how you can feel until you start supplementing. There are some men who have very, very low levels of testosterone, and they just thought this is how life is supposed to be. And once they started supplementing, it like completely changed how they feel, their mood, their sex drive, their energy. They didn't even know it was possible. It was almost superhuman in some instances for these men who have really low testosterone to begin with. So in some situations, it can really be life-changing. Now, as far as the cons go, there are a lot of things we also need to discuss to be thorough in this discussion to weigh out your options as far as pros and cons go. Now, if you are working with a physician and they're giving you the right amount of testosterone, a lot of these issues may not be a problem, but you have to experiment and see what works for you, because everyone's body chemistry works a little bit different. So you have to really see how you respond to these types of therapies. In some cases, for men who begin to use TRT, it can cause acne, oily skin, fluid retention. In some cases, it can actually increase issues like sleep apnea, increasing red blood cell count, and even increasing risk of cardiovascular risk. So it depends on the individual. Sometimes it can have the reverse effect too. So you have to really be checking your blood labs, working with a physician. These types of things are really important, so you're making sure you're not trending in the wrong direction. Usually what these negative symptoms are associated more with taking too much at one time, and then those symptoms can rapidly be alleviated by just getting the proper dose that's ideal for you. The other issue is, and this is what most people are concerned about with TRT, is there's a natural suppression of testosterone. So if you're taking testosterone from an exogenous source, naturally your testes are going to get lazy and not want to produce testosterone on its own. So you have to kind of weigh those pros and the cons. In some situations, people who take too much exogenous testosterone for too long, their body just stops producing testosterone. Really, it only starts producing small amounts on its own, and you have to do other therapies to reactivate the production of testosterone on your own. If someone has a medical condition or a genetic predisposition to not produce enough testosterone, supplementing with it is better for your entire life, is honestly better than not. But you have to just understand how this works so you can make the right decision. Something to also keep in mind, and I guess this is kind of a con, but it's in this category just to put it out there, is just, and I mentioned this before, it's monitoring your labs, monitoring your blood work, making sure that you're healthy, because you can be extremely healthy on testosterone. But again, if you're taking too much or you're not using it in a proper way, it can go the opposite direction. So you have to be smart and monitor your lab work properly. Then there's a cost point where if you can't afford it, that's a problem. Insurance does cover it in most places, but it depends on the individual. The nice thing is, though, this is a side note, testosterone is not that expensive compared to other types of medications, but it's still something to keep in mind when you're trying to calculate the pros and the cons if this is a right decision for you. And then the last con that is important to understand, there's different ways to get testosterone, and they're coming out with more and more ways to supplement with testosterone. There's things like gels, creams, patches, but the most popular way to get testosterone into your body is actually through injection. And so there are people that are nervous of needles. There are people that will go to a clinic and the doctor can administer the testosterone for you once a week or something, if that's easier. I'm not as big of a fan of that, because if you're doing that, you're spiking your testosterone and then it drops. And then you're like on this hormone roller coaster. It's better to be actually injecting the testosterone more frequently throughout the week so your levels are more consistent. If you can do it, I personally recommend doing it every single day. And you can use like an insulin needle, which is very, very fine. It shouldn't even be painful if you know how to do it correctly. And your doctor can show you how to do that, where then you're only giving yourself a small amount every single day. Your testosterone levels are very balanced and even. But obviously that's a con for some people because they don't want to be stabbing themselves with a needle every single day or multiple times a week. So again, you need to weigh out those options. The creams and the gels do work, but they're very, very expensive at this point because they're kind of new, and they actually still don't increase your levels as much as doing injection. Now, this other point, and I didn't have this on my notes, but I want to bring this up, is if you do supplement with testosterone, you're not going to have to necessarily worry about suppressing your natural testosterone forever if you approach it correctly. So the way I coach my clients around this is using other types of tools to stack on top of it, like enclomiphene, for example, which will increase your natural production of testosterone. And so doing a combination of those things, you can actually supplement with a little bit of testosterone, but still maintain a natural production of testosterone, so you're not completely suppressing it all the time, which could then have long-term repercussions. But the main takeaway here is, like, in my opinion, I'd rather have higher levels of testosterone until I die, then start to kind of taper off, and I feel shittier and shittier as I get older. So again, it's a personal preference. You need to weigh out the pros and the cons of this to make the right decision for you. So the reward for staying to the end is I wanted to discuss some blood levels to look for as far as knowing where you're at for testosterone. What I recommend doing is getting some lab tests done to see where you're at. Normally, physicians will be kind of on the conservative side and say you don't really need that much testosterone compared to what I recommend to my clients. So it's up to you. You can go by their recommendations, see how you feel. And this isn't medical advice like I put at the beginning of my video, but increasing your testosterone levels a little bit higher than the standard recommendation, you feel a lot better. And so what I recommend doing is your total testosterone levels closer to 1,000 nanograms over deciliters, which is quite high for some people by their standards. But, like, for example, for me, naturally, when I was in my 20s, I was up to 700 for my total testosterone. So it's not super far off, but it's a little bit higher than I think a lot of men can do naturally. It is possible to even raise your levels up to 1,000 naturally, but you have to really be pristine and kind of taking out a lot of the stressors in your environment. Now, as far as free testosterone levels go, closer to 26 nanograms over deciliters tend to be really good for noticing more significant abilities to build muscle and noticing more libido improvements, in my opinion. Some other bonus lab tests to be looking for that I also think are helpful is estradiol. I made other videos on this, on trying to keep your estrogen low because it is a stressor on the body and it will actively fight at lowering your testosterone. And so monitoring estradiol is really important, making sure that it's not too high. So you can use the reference ranges as a reference point for that. Sex hormone binding globulin and also luteinizing hormone, looking at those levels too and making sure that they're within reference ranges. That's very, very important to make sure that things aren't getting out of whack and that you're able to keep your levels in a healthy balance. If these levels are in good balance too, the negative symptoms I was talking about probably won't be there, but it's something to be mindful of as you're monitoring your progress. There are other labs too to check, but I think for the sake of this video, that's a really good starting point. So I hope you found that useful. Don't forget to like, subscribe, hit the bell icon for more notifications on types of videos like this. Let me know if this content was useful, if you want me to drill down and talk about any topics around this in a little bit more detail, because I think this is one of the most foundational topics for us as men to really feel really good. So I want to make more videos on this specific topic. So let me know your experiences, any questions, anything like that. It's very helpful also. I think that's it for now. Right about now, there's some other videos. I think I have some playlists up too, all related to testosterone, so you can check those out. I would say go through those videos as well because they're going to be helpful to give you a nice reference point on more natural ways to increase testosterone versus just going straight into the TRT. I would personally try to do these other options first and then consider the TRT option as a last resort. So let me know if you have any other questions. I hope you're having a fantastic day, and I will talk to you soon.